The mandibular nerve. The mandibular nerve is one of the branches of the trigeminal ganglia. It's the third branch, so it will leave the foramen ovale. The first branch that will be around the mandibular nerve will be the meningeal branch that will go out in the foramen spinosum. This branch supplies the meninges of the middle cranial fossa and the mastoid hair cells. Then we have the anterior branches of the mandibular nerve that are mostly motor, except for the lingual and buccal nerve. So the medial pterygoid nerve supplies the tensor tympani and tensor pallei. Then we have the cutaneous branches of muscle of mastication, named for the muscle of mastication. So we have masseter nerve that supplies the masseter muscle. Then we have 2 to 3 temporal nerves that supply the temporalis muscle, and the lateral pterygoid nerve that supplies the lateral pterygoid muscle. Then the buccal nerve will travel and they will pass the 2 heads of the lateral pterygoid muscle and will supply the cheeks, buccal mucosa, buccal gingiva, and over the mandibular molars. Mandibular because it's a mandibular nerve, of course. Then the chora tympani will leave the petrotympanic fissure, will join the lingual nerve as a hitchhiker. A lingual nerve will supply the tongue, sensory innervation to the tongue, and chora tympani a special sense to the 2/3 anterior tongue. Then we'll have the auriculotemporal nerve. Auriculotemporal nerve is sensory to the deep and superior part of the parotid gland. Then the inferior alveolar nerve will give branch to the mylohyoid nerve. Mylohyoid nerve is motor to mylohyoid muscle and anterior belly of the digastric. And then the sensory part of the inferior alveolar nerve will be the incisive nerve and the mental nerve.